So in this section, we're going to be looking at how stressful events can impact on our health and on our mental well-being. So as far back as the ancient Greeks, there's been seen a link between, what happens in our everyday lives and the impact that that can have on our health and well-being. And the idea is that the more stress that we get, the iller that we become. And this link has been seen throughout history. But what is really interesting is that it doesn't always happen, does it? So sometimes people can go through really stressful events, they don't seem to get ill, and other times, like when we're taking exams or moving house, we just seem to come down with the flu or, have the 12th cold that year because we attribute that to the stress that we've been under. So I think this link between stress and illness isn't as clear-cut as we might like to think it is. Actually, there seem to be some mediating factors that stop it from being just a sort of causal link. Now, this area of psychology is relatively new. I think it wasn't until the 1960s when George Solomon published a paper on looking at the integration between emotions, immunity and disease, that people started to really investigate what it was that caused things like anxiety and stress to actually, in some cases, manifest as physical and mental health problems. Now, this area of psychology has a bit of a tricky name. It's called psychoneuroimmunology because it mixes the psychology with the immunology, and it puts the brain right there in the middle of it because it's how we perceive things that can have a huge impact. So let me expand on that a little bit more and let's have a look at a case study. So let's take the case of Les. So Les is an A-level student and they are about to take their exams. And we could say that exam taking is a very subjective experience and that not everybody feels stressed about taking exams. There are some annoying people who actually enjoy taking exams, but we're not going to talk about that, and that isn't the case for Les. Les gets quite worked up about taking exams, and this starts to have some impact on Les. So how could that then lead to ill health? Well, in the first case, we might have Les worrying about his exams before they go to bed. In this case, it might be that the exam stress causes disruptions to sleep cycles. Now, we know at an epidemiological level, so that's when we look at large amounts of data, that there is a link between poor sleep patterns and diseases like diabetes. Now, in Les's case, it's not likely that a few nights of exam stress are going to actually lead to something like diabetes, but there are other things that could be happening. We do know that sometimes if we have a few nights of disruptive sleep, that can impact on our ability to produce some of the hormones that are involved in supporting the immune system. And that might mean that Les is actually more susceptible to things like coughs and colds or sickness bugs during his exams because he's not as able to fight off the pathogens as he would be at other times. Now, there are other things that might happen to Les when he's doing his exams. Might not decide to go to the gym as often so he can concentrate on his revision, which would mean that he's not exercising as much. We know that exercise actually is really beneficial in supporting the immune system. The other thing that might happen is that Les might start to not eat very healthily. So, for example, Les might decide that it takes too much time to cook a healthy meal and what they really fancy is pizza and chips. Now, at that point, we know that diet is really important for supporting immune function, and that our immune function is much better when we eat a mixed diet with lots of fresh vegetables and fruit. So already we can see that there may be a link between the exam stress that Les is feeling and his susceptibility to certain illnesses like coughs and colds, which is why it's really important when people are advising that they eat a healthy diet, they maintain a good level of exercise, and they do try and relax before they go to sleep so they get a good night's sleep. Now, further evidence for the link between stress, specifically exam stress, and health came from some studies done by Marucha, and he did these great studies where he looked at wound healing. And what he did was he took a bunch of students and he actually created a standardized wound in their mouth, so a small circular hole in the soft palate of their mouths. And what he was interested in was how quickly that hole would heal. And what he did was he looked at how long the wound took to heal just before some major exams, and then he looked at the same wound healing but in a more relaxed time period, so in this case over the summer holidays, and compared the two. And what he found was that on average the wound that had been created just before exams took about 40% longer to heal than it did when the same wound was made in the summer. And what he suggested was that it was down to a wound healing factor called interleukin-1, which was much lower during the exam period than it was during the summer. So again, we can see that stress can have an impact on how the body responds to things like wounds. We also know that there are a number of mediating factors, which is why it isn't a direct link between stress and illness. And if we go back to the case of Les, there are many things that could help Les to feel better during the exam period. One of the most critical ones that we've come across is social support, and there have been many studies that have shown that people who have good levels of social support, i.e. they have lots of friends and family around them during stressful times, don't show the same detriment in their physical and mental health as those people who are perhaps more lonely and don't have people that they can rely on. So we definitely know that if you are going through a stressful period, so for example during the run-up to exams, it's important not to neglect family and friends, and having time out to go to the movies or to go out to a cafe for a coffee with the people that are near and dear to you is actually a really good way to mediate the negative effects of stress and to keep you fit and healthy. So what happens when we talk now about chronic stressors? So we've talked about the acute ones, such as taking an exam. What happens when we are exposed to a stressor that goes on for many, many months, or, you know, has a high duration of time? Well, we do know that the body mounts a physiological response to threat, and this is a very high energy cost to the body. So if you're in a really chronically stressful time, your body is constantly being bombarded with this need to respond physiologically to what is perceived as a threat. Now, this can be really damaging for the body because it just gets burnt out, and it can mean that either you're always in a really high state of anxiety because you continually perceiving this threat to be around, and it becomes very hard to switch off that threat response, or your body just gets burnt out and you're so tired of continually mounting this physiological response to this chronic stressor that your body has no energy and you just don't respond anymore. And those people can exhibit symptoms that are a bit like depression, so they just can't quite bring themselves to be bothered by things that you sort of think they should be bothered by. So one psychologist, in fact a famous endocrinologist called Martin Tusk, was really interested in this idea, and he said it was a little bit like a firefighter. And in this metaphor, what he suggests is that when we see stress, it's like a fire, and the firefighter would go and have a hose and would wash away the stress with the correct amount of water. However, he says, when we become unbalanced and that chronic stress has been going on for so long, sometimes we go up to the fire and we just put far too much water on it, and we're just really overloading our physiological response to a higher level than we really need to. So he says this is like a hose that's out of control. On the other side, he says that sometimes when we're in burnout, it's like a firefighter who goes to a fire, i.e. the stress, and he points the hose at it and only a little trickle of water comes out. And in those situations, we haven't got enough energy and resource left to mount the stress response that we need to deal with the stress. So I think, in summary, it's really important to understand stress and its impact on well-being and on physical health, and look at the mediating factors that can change that relationship.